Welcome back to Talk of the Town. I'm joined now by Grant Cully, one of our old friends with Harbour Health Insurance. So happy to have you with us, and we want to talk about the Affordable Care Act. I know you've spoken with Sandy about it before. The thing that everyone's getting excited for is coming up in October, we have open enrollment. So in 2014, we have that healthcare mandate that, does that exist? Is there going to be a 2014 mandate for health insurance? If you don't have health insurance, you have to pay a fine. What's the solution here?
There's been a lot of changes in it, Kevin.
Yeah.
Large groups were actually going to be mandated to offer health insurance, groups of 50 and plus, but that's been postponed until 2015.
This is the employer mandate.
That's the employer
So
mandate.
if you have a business of more than 50 employees, that's considered not a small business.
That's right.
Mid-size or large business. Then you don't, for 2014 at least, you are not required to offer insurance to your employees yet.
Yes. Yes. Okay. It was actually in the legislation that 2014 large groups, 50 or more employees, were going to be mandated to offer affordable health care with essential health benefits to their employees or pay a penalty. But that's been postponed until 2015. Small groups do not offer, don't have to offer health insurance to their employees, nor do they have to pay a penalty. But individuals do have a mandate to have health insurance by January 1st, 2014.
So
that's coming up.
That's coming right up. So what is the penalty for someone that is an individual who opts not to purchase health insurance? I come from Massachusetts, where Mitt Romney threw in the whole healthcare reform, and I lived through that system. And they created this thing called the Commonwealth Connection, where it was basically subsidized care for people that otherwise couldn't afford the care.
That's right.
We have open enrollment now. That's something that a lot of people don't seem to understand either, which is really important, because if you're going to have a mandate for health insurance and the only time you can sign up is between October and January to be compliant with the law, you have to do it now. What do you do? I mean, people don't seem to understand, I certainly don't understand, that I'm going to pay a fine if I don't have health insurance and I'm not buying it comprehensively, as is required by the government, starting January 1st of next year. Is that correct?
That's right. The penalty for the first year is pretty mild, actually. If an individual does not have health insurance, they're either going to have $95 penalty or 1% of their income.
Okay.
In the second year, however, in 2015, it's going up to $325 or 2% of their income, and in the next year, it's going to be $695 per person, half of that for a dependent, or 2.5% of your income.
And for a lot of people, that's about what healthcare costs.
That's right.
Yeah.
Well, it could be. When you're looking at maybe 2.5% of your income, that ends up being quite a bit of money. And remember, not only do you have to pay the penalty, you don't have any health insurance.
Yeah. So I think it's so much important for people to be educated about what the mandate means, and about basically they're obviously trying to disincentivize people to not have insurance. They want everyone to be insured. That's how they'll bring down healthcare costs. Is that the idea?
That's the idea. Try to increase the number of people that are insured so we can predict what the costs are. Now, they don't know whether or not that prediction is going to be higher cost, or if by having more people covered, they're going to be able to anticipate what the overall cost is, and it may lower the cost.
Right.
But we're going to pick up quite a bit more risk.
More people have access to care.
That's right.
And so if someone is going to be able to receive preventative care, which would make it less expensive to treat an illness or a condition, that's advantageous to the aggregate cost of the system. However, of course, if someone is over-consuming care or consuming more than they would have without insurance, that obviously adds cost to the system and tax too. So
that's right. If they can find out that they have some type of an illness or something like that ahead of time and have it treated, it can be a lot less expensive.
Yeah. I mean, it's such an important issue, because I know my parents work at Beaufort Memorial Hospital, and they make a multi-million-dollar profit every year. But in the past few years, that profit has not been enough to overcome the losses they receive from what's essentially free care.
Right.
Caring for individuals who don't have insurance.
Those who are uninsured.
Yes. So for those individuals, that's what this legislation is about. And it is open enrollment for people who don't understand what open enrollment is between October 1st and January 1st.
Actually, open enrollment for the initial year is going to be October 1st through March 31st.
Okay, so you almost have, basically until you're doing your taxes.
That's right.
You can go buy some insurance.
And then in the preceding year, it's going to be from October 15th until December 7th for a 2015 effective date. And that'll be the annual open enrollment periods.
That makes sense. So, Grant, we have about 1 minute left. What's something that our viewers need to know that we haven't already talked about?
Well, the application process, that's one thing that's very, very important. I will say that the government's done a very good job of putting together and simplifying the application. Originally, it was 24 pages long.
Wow.
They've gotten that reduced to about they've gotten it reduced to about 4 to 5 pages. And on that single application, you'll be able to determine your eligibility of being able to participate in the exchange.
So this is a federal insurance subsidy.
Yes, the subsidy will also be on that application, and you'll be able to determine whether or not you get subsidy, and you'll be able to determine whether you get cost sharing reductions, and if you're eligible for Medicaid or the Children's Health Insurance Plan.
Wonderful.
A lot of information on the application, though. You have to verify your eligibility, your residency, your occupation, your income. So it's not really easy, and people should be prepared with that information before they try to fill out the application.
Definitely. Grant, Cully, we appreciate you looking out for us.
You're welcome.
Helping us get some people insured, pay for healthcare costs. We appreciate you.
Thanks.
Talk at the Town. We'll be right back. Thank you.